This is a recording for Chapter 12 and the use of Z codes. That is Chapter 12 in the handbook. And Z codes are used for factors influencing health status and contact with health services. So what does that mean, factors influencing health status? What factors does that patient have that maybe you're not coding as an active diagnosis, but it impacts their health? Maybe they have a family history of a certain condition, or maybe their status post joint replacement or status post organ transplant. Those are all factors influencing their health status, and we want to code those to show the severity and the complexity of that patient's healthcare status. So we want to add those on as codes, and those codes start with a letter Z. We're going to look them up in the index, but we're going to end up in the tabular in the Z codes. The Z codes also represent reasons patients contact health services. So those reasons might be for, say, a sports physical or an employment physical, or maybe they're coming in just for a vaccine, or a follow-up to something, even screening, mammogram, that type of thing. So Z codes represent factors influencing health status and reasons that patients contact health services. Now, a patient might not have any Z codes. Okay. Or a patient might have Z codes for one or both of those reasons. They might have a family history of breast cancer, and they're coming in for a screening mammogram. So that's a factor influencing their health status, and that's a reason to contact health services. So sometimes Z codes can be first listed or the principal diagnosis, and sometimes they are other or secondary diagnosis codes. In that regard, only certain Z codes can be first listed. And if we look at some of the official guidelines in the front of your code book again, if you look on page 24, in the second column there, the right-hand column, it says Chapter 21, Factors Influencing Health Status and Contact with Health Services. It gives you the Z code range there. And then it goes down to letters bolded here, A, B, C, D. These are different reasons why patients might come in. Okay, that would fall into the Z code categories, and it goes over multiple pages. You can see screening, observation, aftercare, follow-up, and then if we look at page 29, the left-hand column, it says 16 Z codes that may only be the principal or first listed. So if they're coming in for this reason, this code can only be listed first. If they're coming in for this reason and something else, that something else or this should be listed first. You'd have to want to look to see where the most resources went for that patient. But generally speaking, these are going to be principal diagnoses only. The other Z codes most likely are going to be, or can be first or second, I should say. Okay. How do you look these terms up or conditions up in the index? On page 126 in your handbook, towards the bottom it says Locating Z codes, and it gives you bulleted lists there of some example main terms. Admission for, examination for, history of, observation, and so on. I'm going to give you a few other ones here if you would like to document these. You might, and you're going to find these in the main index. You're not going to find them in the external cause index, but in the main index. Encounter is another main term. Suspected. Absence or absence of. So if a patient is missing an organ, oftentimes we'll indicate that with a Z code. Screening. Donor. Let's say a patient is a donor of their kidney for their brother. their diagnosis is going to be a Z code, saying that they're a donor. Follow-up, problem, transplant, vaccination, prophylactic. And there probably are many more, but these are a good start. Sometimes you'll find entries under admission 4, and it might be an outpatient physical. And we think admission means inpatient. Well, it can go both ways. It's just the strange terminology of the diagnosis classification system. So lots of good examples in the chapter here of reasons to contact health services or factors influencing health status. Under the main term history in your index, I might point out to you that there's patient's personal history and there's family history. So be sure to not mix those up. Also, terms history of oftentimes or most often represent a previous history of a diagnosis, whether it's the patient's or the family. Status post as a main term most often refers to a patient's previous procedure or surgery. That ends the audio recording.